Hello, my name is Jose Enrique Arauz, and I will talk about artificial intelligence to detect papilledema from ocular fundus photograph. Definition: papilloma is the acquired elevation of the optic disc that occurs as a consequence of increases in intracranial pressure caused coronial plexus tumor, thrombosis of the cerebral veins, sinusite, intracranial hypertension, hypertrophic of the cerebral spinal fluid, atrophic intracranial hypertension.
So, Ms. Moran, I've been told that I have papilledema. Can you tell me more about that, please?
Yes, so papilledema is what we can see when we examine the back of your eyes, and what that can be is it can be a sign of raised intracranial pressure. Now, it's sometimes not very easy to tell whether people have what we say is papilledema or pseudopapilledema. And what I mean by pseudopapilledema is that sometimes the nerve looks swollen and elevated, but in fact it's not due to brain pressure. So often when we go to the opticians and they look in through an undilated pupil, they get the impression that the nerves are elevated, and that signals for them to send somebody urgently to the hospital to be evaluated. When they come to the hospital, quite often the doctors look with what we say is called an ophthalmoscope. So sometimes they're not able to put drops in the eyes, and they actually look with a torch in the eyes to have a look at the elevation of the nerves, because they need to confirm whether the nerve is swollen or not. If they're unsure, in the emergency situation, they often ask an ophthalmologist, an eye doctor, to come and have a look at the back of the eyes.
More experience of the eyes.
Yeah, and also we've got sort of more useful instruments such as the slit lamp to be able to have a good look at the back of the eyes and evaluate whether we think there's true swelling or whether it's pseudo swelling. So some of the causes of pseudoswelling can be little deposits such as drusen at the optic nerve head. These are tiny little refractile deposits that we can sometimes see when we do an ultrasound of the eye. So we ask the patient to close the eye, we put some jelly on, and we use a sort of device a bit like
an ultrasound.
Yeah, just like on what pregnant mums get to look at their babies. So it's sometimes a very useful way to determine whether there's drusen present or not. But sometimes it's even more difficult than that, because sometimes you can have drusen as well as swelling. So you can see that there's lots of different things interplaying. So it's always important that the diagnosis of papilledema or true swelling in both optic nerves is evaluated before invasive tests are done.
Diagnosis based on artificial intelligence of photograph of the ocular fundus. It is the creation of the photograph in the inner surface of the eye, which includes the retina, the optic nerve, the macula, and the posterior pole. It is used from diagnostic survival of the disease progression or in detective programs, where photos can be analyzed later, heard in indication to detect an elevation symptoms of routine detachment of or eye dishes such as glaucoma.
You may have had a retinal photograph taken as part of your eye examination and wondered exactly what is my optometrist looking at. If you look at this photograph here, you can see this small dark area, which we call the macula. The macula is the most sensitive part of the eye, and in some patients as they get older they develop a condition called age-related macular degeneration, where they do lose some of their central vision. Over to the side here, this slightly unusual round structure you can see is the optic nerve head. You can see that it's sort of pink around the edge, but quite pale in the middle. The optometrist will look closely at the optic nerve, because this pallor which you can see in the middle can sometimes indicate early glaucoma. You can also see quite clearly the retinal veins and arteries. The veins are the thicker ones. They're a little bit darker in colour, almost a purple colour. That's because they're carrying blood which doesn't contain any oxygen because it's going back to the heart. The arteries are thinner and they're a brighter red colour because they're carrying blood which is full of oxygen, bringing blood to the eye. It's important to look closely at the veins and arteries because this is where we see changes in patients with high blood pressure and patients with diabetes. The eye, in fact, is the only place in the body where the veins and arteries can be directly observed without making an incision. This retinal photograph is of a healthy eye, but it will still be saved in the patient's record, so that when the patient returns for their eye examination in 1 or 2 years' time, another retinal photograph will be taken and the photographs can be compared, and any changes which are taking place will be spotted immediately.
Application in medicine. The useful of the papilledema find in the photograph of the ocular fundus examined will vary depending on the professional's clinical ability and the condition under which the test is performed. In a discrete study, 23 pictures of the ocular fundus photograph corresponding to a different diagnosis were interpreted by doctors from the different specialties. The clinical judgment of the family seeked for the presence of papilledema obtained a sensibility of 84 and a certainty of 59%.
The comprehensive dilated eye exam, opening the door to preventing blindness. A doctor can detect signs of diabetic retinopathy during a comprehensive dilated eye exam. The patient receives special eye drops that dilate the pupils. The pupils open wide, allowing the doctor to see the back of the eye clearly. When eyes are dilated, the doctor can clearly see the retina, optic nerve, and the macula. Early diabetic retinopathy starts with small red dots called microaneurysms and can progress to leaking blood vessels causing thickening of the retina and blurring of vision, or new blood vessel growth that can bleed and cause blindness. If you have diabetes, you are at risk for diabetic retinopathy. Dilation enables doctors to get a better view of the back of the eye, which allows them to determine whether there are early symptoms of disease. But it's important to know that all people older than 60 need a comprehensive dilated eye exam each year and should inform their doctor right away if they begin to have problems with their sight. People at higher risk may need to have a dilated eye exam more often. Risk factors, including race, age, and family history, are all important to determine how often patients should receive a comprehensive dilated eye exam. To learn more about comprehensive dilated eye exams, common vision problems, and eye disease,
Pros and cons. Pros. The imaging can be examined by other specialists from another place and time. Provides photograph documentality for the future reference. The area displayed in a much larger than what seen with the portable ophthalmoscope comes. A few studies have been identified that analyze the value of the use of artificial intelligence to detect papilledema and another anomalies of the optical disc from fundus photograph for the diagnostic of intracranial hypertension and papilledema. Use applique in Ecuador. There are no certificate studies on the studies of artificial intelligence to detect papilledema from an ocular fundus photograph in Ecuador. And conclusion. A PET learning study used fundus photograph which pharmacology dilatate pupils differently among optical discs with papilledema normal and with not papilledema abnormalized.
Papilledema is swelling of the optic nerves secondary to raised intracranial pressure. Therefore, in any patient who has worrisome headaches, it's important to examine the ocular fundus looking for papilledema. Depending on the duration of the pathology which has caused the raised intracranial pressure, papilledema can go through various stages. The earliest stage can be quite subtle and difficult to pick up. It involves subtle swelling of the optic disc margins, mostly where the nerve fibre layer is thickest. So to start with, this is superiorly and inferiorly, and then later nasally. As papilledema becomes more established, the swelling can progress circumferentially around the optic nerve, leading to a blurring of the optic disc margins. Established papilledema is associated with hemorrhages on the optic nerve head and also around the optic nerve head, and in addition, the central vessels on the optic nerve can become obscured as the tissue swells around them. Chronic papilledema is where the optic nerve is still swollen, but also the disc appears pale due to loss of nerve fibre layer tissue, and then we go on to the end stage of papilledema, which is called atrophic papilledema. At this stage, the optic nerve head is pale, but it is also flat due to the degree of neural tissue loss. Other important features of papilledema, including the fact that it can be asymmetrical, which is why it's important to examine both eyes, and also in chronic or severe swelling, you can get associated protein deposits in the macula beside the disc, telling you that the papilledema has been there for a significant length of time. The most worrisome symptom associated with papilledema is headaches, particularly worrisome headaches. With regards to visual symptoms, there are remarkably few until papilledema becomes established. At that point, the patient may report episodes of transient visual loss. These can last from a few minutes to a few seconds and can involve greying out of the vision or positive visual phenomena such as bright flashing lights. After each attack, the vision should recover completely, and they can be precipitated by moving from a sitting to a standing position. It is only when the papilledema becomes end stage or atrophic that the patient will then be aware of visual symptoms such as visual blurring and or loss of visual field. The main group of conditions that can mimic papilledema are the anatomical variants of a normal optic nerve. These would include disc drusen and the crowded optic nerve, which can be found in patients who are long-sighted. However, because both these conditions are just anatomical variants, they should not be associated with headache. Conditions causing inflammation of the optic nerve can also cause a papillitis or inflammatory swelling of the optic nerve, but these conditions affect vision early, unlike papilledema. It has been suggested that pulsation of the vein on the surface of the optic disc can be used as a surrogate marker for normal intracranial pressure. Although this is sometimes true, this sign should not be used to differentiate papilledema from other causes of anomalous appearing optic nerve heads.
Thank you.